Hello everyone, welcome to Gua Sha for Diabetes, brought to you by Lamp AccuWellness Foundation Inc. It is a common disease caused by interaction between hereditary factors and environmental factors. According to Chinese medicine, it is called drinking and urine, mainly marked by hyperglycemia in clinical practice. There are such common symptoms as drinking more, urinating more, eating more, becoming thin. Long-term diabetes will lead to chronic harm and functional obstruction to various tissues, particularly to the eyes, kidneys, heart, blood vessels, and nerves. The increase of glycogen content in the skin of diabetic patient will create a nice environment for infection by molds and germs. Therefore, the scraping oil must be applied to protect the skin when the scraping is done. It should be done gently to prevent the wounds on the skin from being infected. The distal limbs are not sensitive, requiring more care. The corresponding area of the pancreas on the spine. Method: use the surface scraping and the dual angle scraping to scrape the area from up to down. The corresponding area of the pancreas on the spine and the projection area of the pancreas on the body surface. For the projection area of the pancreas on the body surface, use the flat scraping to scrape the area on the ribs from inside to outside. Pishu point, Senshu point, Yangkang point, and Yi-sheaf point. Use the surface scraping to scrape from Pishu point to Shenshu point and from Yangkang point to Yi-sheaf point of the bladder meridian on both sides on the back. Bladder 20, Pishu, Spleen Shu. On the back, 1.5 tsun lateral to the lower border of the spinous process of the 11th thoracic vertebra. Bakshu point of the spleen. Tonifies spleen, stomach qi and yang. Nourishes blood, resolves dampness, regulates spleen and stomach qi. Bladder 20 is an important point to use for any spleen pattern. Excellent point to tonify the spleen and stomach for chronic conditions. Bakshu points are corresponding points on the back where the qi of the respective zangfu organ is infused. If the 5 zang organs are diseased, abnormal reactions appear on the Bakshu points. Bakshu points have a direct therapeutic effect on the diseases of the 5 zang organs. Needling, oblique insertion, 0.5 to 0.8 tsun. Bladder 23, Sen Shu, Kidney Shu. On the back, 1.5 tsun, lateral to the lower border of the spinous process of the 2nd lumbar vertebra. Bakshu point of the kidney. Strengthens the kidneys, tonifies kidney yang, nourishes kidney yin and essence, strengthens kidney's ability to grasp the qi, benefits the ears and bones, strengthens the low back, resolves dampness. Bladder 23 is one of the most effective points to tonify the kidneys. Needling, perpendicular insertion, 0.5 to 1 tsun. Bladder 48, Yang Gong, Yang head row. Location, on the back, 3 tsun, lateral to the lower border of the spinous process of the 10th thoracic vertebra. Regulates the gallbladder, clears damp heat. Needling, oblique insertion, 0.5 to 0.8 tsun. Bladder 49, Isha, reflection abode. On the back, 3 tsun, lateral to the lower border of the spinous process of the 11th thoracic vertebra. Regulates the spleen and stomach, clears damp heat. Bladder 49 is the outer bakshu of the spleen. Its special feature is that it helps treat the psychological spiritual aspect of the spleen. Therefore, bladder 49 can be used to treat memory, overthinking, or obsessive thinking. needling, oblique insertion 0.5 to 0.8 Sun. Song 1 point and Qi Hai point. Use the surface scraping to scrape from Song 1 point to Qi Hai point of Ren meridian from up to down on the abdomen. Scraping is done respectively on the upper part and the lower part with Shenkue point as the border. Ren 12, Zong 1, middle epigastrium. On the anterior median line of the upper abdomen, 4th Sun above the umbilicus. Ren 12 is front mu point of the stomach, converging point of the Fu organs, crossing point of the Ren vessel and small intestine, Sanjiao, and stomach meridians. Strengthens and harmonizes the spleen and stomach, resolves dampness, relieves pain. Front mu points can be used to treat diseases of the affected Zangfu organ and those of yang meridians and collaterals. They treat diseases of 6 Fu organs and diseases of yang meridians. An adverse reaction when a front mu point is pressed can help make a diagnosis. Needling perpendicular insertion 1 to 1.5 Sun. Ren 6, Qi Hai, Sea of Qi. Location on the anterior median line of the lower abdomen, 1.5 Sun below the umbilicus. Strengthens kidney qi and yang, regulates qi, benefits original qi, treats prolapse. Ren 6 has the function to tonify as well as maintain health. Needling perpendicular insertion 1 to 2 Sun. Yang Si point, Susanli point, and San Yin Chiao point. Method: use the flat pressing and kneading to press and knead Yang Si point on the wrist. Use the corner of the scraping plate to scrape Susanli point and San Yin Chiao point on lower limbs from up to down. SJ4, Sanjiao 4, or triple burner 4, is Yang Si Yang Pool. On the transverse crease of the dorsum of the wrist, in the depression on the ulnar side of the tendon of extensor digitorum communis muscle. Yuan source point of the Sanjiao meridian clears heat, activates the meridian, relaxes the sinews, alleviates pain. Clinically, Yuan source points are of great significance in treating diseases of the internal organs. Yuan source points are the sites where the Yuan primary qi of the Zangfu organs passes and stays. Puncturing the Yuan source point stimulates the vital energy of the regular meridians, regulates the functional activities of the internal organs, reinforces anti-pathogenic factors, and eliminates pathogenic factors. This method of treating diseases deals principally with the root causes. The Yuan source point from the affected meridian is often combined with the Lu connecting point of the internally-externally related meridians in use. Needling perpendicular insertion 0.3 to 0.5 Sun. Stomach 36, Susan Li, leg 3 miles. On the anterior aspect of the lower leg, 3 Sun below stomach 35, 1 finger breadth using the middle finger from the anterior crest of the tibia. Hisi point of the stomach meridian, command point of the abdomen, point of the sea of water and grain. Functions: tonifies qi and blood, harmonizes and strengthens the spleen and stomach, strengthens the body and wei qi, raises the yang, calms the sen, activates the meridian, stops pain. Stomach 36 is known as one of the most important points to tonify qi and blood and promote general wellness. Hisi points are where the qi of the meridian collects and goes deep into the body. Hisi points are known to treat rebellious qi and diarrhea. Needling perpendicular insertion 1 to 2 Tsun. Spleen 6, San Yin Jiao, 3 Yin intersection. On the medial aspect of the lower leg, 3 Tsun above the medial malleolus, on the posterior border of the medial aspect of the tibia. Crossing point of the spleen, kidney, and liver meridians. Spleen 6 strengthens the spleen and stomach, resolves dampness, harmonizes the liver, strengthens the kidneys, nourishes blood and yin, regulates menstruation, cools and invigorates the blood, benefits urination, calms the shen. Spleen 6 is one of the most commonly used points and one of the most versatile. Because the point crosses the spleen, kidney, and liver meridians, it can treat many conditions associated with all three organs. It's an important point in the treatment of any digestive, gynecological, and emotional condition. Needling perpendicular insertion 1 to 1.5 Tsun. Do not needle during pregnancy. Therapies to increase the curative effect. Use the surface scraping to scrape Sao Fu point and Taiyuan point from up to down for the patients who drink more. Heart 8, Sao Fu, Lesser Mansion, on the palm between the 4th and 5th metacarpal bones. When a fist is made, the point is where the tip of the little finger touches. Heart 8 is yin spring point of the heart meridian. Calms the shen, clears heat, mostly the excess type, clears heat from the heart and small intestine. Yin spring points are where the qi dribbles down the meridian. Yin spring points are indicated for heat in the body and changes in the complexion. Yin spring points are known to clear heat from the meridian. Needling perpendicular insertion 0.3 to 0.5 Tsun. Lung 9, Taiyuan, Great Abyss, on the radial end of the transverse crease of the wrist, where the radial artery pulsates. Lung 9 is Yuan source point of the lung meridian, shoestring point of the lung meridian, converging point of vessels. Lung 9 tonifies lung qi and yin, resolves phlegm, descends lung qi, tonifies gathering qi, influences the pulse. Clinically, Yuan source points are of great significance in treating diseases of the internal organs. Yuan source points are the sites where the yuan or primary qi of the Zangfu organs passes and stays. Puncturing the yuan source point stimulates the vital energy of the regular meridians, regulates the functional activities of the internal organs, reinforces anti-pathogenic factors, and eliminates pathogenic factors. This method of treating diseases deals principally with the root causes. The yuan source point from the affected meridian is often combined with the Lu connecting point of the internally-externally related meridians in use. Shoestring points are where the qi starts to pour down the meridian. They are known to alleviate heaviness and pain in the joints. On in meridians, shoestring points are identical to the actions of yuan source points. Needling perpendicular insertion 0.3 to 0.5 Tsun. Keep clear of the radial artery. Use the vertical pressing and kneading to scrape stomach 44 and use the surface scraping to scrape spleen 7 point on both sides of the spleen meridian from up to down for the patients who eat more. Stomach 44, Nei Ting, inner courtyard, on the dorsum of the foot proximal to the web margin between the second and third metatarsal toes at the junction of the red and white skin. Stomach 44 is yin spring point of the stomach meridian. Clears heat from the stomach meridian, resolves Damp heat in the intestines relieves pain. Needling, perpendicular or oblique insertion, 0.5 to 0.8 Sun. Spleen 7, leaking valley. On the medial aspect of the lower leg, 6 Sun above the medial malleolus, on the line connecting the tip of the medial malleolus and spleen 9, on the posterior border of the medial aspect of the tibia. Spleen 7 tonifies the spleen, resolves dampness. Needling, perpendicular insertion, 1 to 1.5 Sun. Use the flat pressing and kneading to scrape Tai Si point and the surface scraping to scrape San Yin Jiao point for patients who urinate more. Kidney 3, Tai Si, great stream. On the medial aspect of the foot, posterior to the medial malleolus, in the depression between the tip of the medial malleolus and tendocalcaneus. Kidney 3 is Yuan source point of the kidney meridian and shoestring point of the kidney meridian. Tonifies the kidneys, yin and yang, strengthens the low back, relieves heel, ankle pain. Kidney 3 is important to use for any kidney deficiency pattern. Needling, perpendicular insertion, 0.5 to 1 Sun. San Yin Jiao, spleen 6, crossing point of the spleen, kidney, and liver meridians. Thank you very much for your attention. See you on our next videos.